Good afternoon, everyone. Our today's topic is pertussis, or commonly known as whooping cough, based on the characteristic whoop or the sound that a person makes on inspiration. Today, under this topic, we'll be talking about the problem statement of pertussis, the epidemiological determinants, and the treatment. Coming to the history, whooping cough was described in 1640 by Ballow, who was an epidemiologist. Pertussis means violent cough and was first used to describe the disease in 1679. In China, this disease is called as the 100-day cough. Why is it called 100-day cough? Because the severity of the cough can last up to even 100 days. That means it takes many days for the cough to regress and go away. So this pertussis is a highly contagious disease caused by Bordetella pertussis. It's usually seen in younger children, but even adults are affected by this disease. Pertussis is characterized by severe coughing spells, sometimes, as I said, ending in a whooping sound, which is a loud crowing inspiration. On inspiration, the sound looks like that made by the crow. When person breathes in, that is during inspiration. Often this coughing, when the coughing is so vigorous, it's associated with cyanosis and vomiting. Infants less than 1 year constitute 50 to 70% of the diagnosed cases. So adults and adolescents are also affected, but it's not that common in adults and adolescents as it is common in the children. And in children, it's very lethal. The common cause for being lethal in children is that the children and the infants are malnourished, and most of the times they have other associated respiratory diseases as well. Now, coming to the problem of this pertussis, as I said, this is the important cause of death in infants worldwide. It's a disease of public health concern, even in countries with high vaccination coverage, because it's taking toll on the lives of the young infants and children. In 2018, around 1.51 lakh cases were reported globally to the WHO. In India, there has been a decline in the number of cases with the launch of universal immunization program. In 2019, it was 11,875 cases were reported. Now, coming to the epidemiological determinants, like for all communicable diseases, the epidemiological determinants are classified or based as agent factors, host factors, and the environment factors. Now, coming to the agent factors, as you all know, that the agent for this pertussis is Bordetella pertussis. This is the most common cause of pertussis in young children and infants. In less than 5% of the cases, the cause is Bordetella parapertussis. Both these variants are gram-negative coccobacilli, and they are recovered on Bordet gango media. Certain viruses like adenoviruses are also believed to cause the disease, but the true etiology and the mechanism how they cause this whooping cough is not well established. Now, what's this Bordetella pertussis? This is a motile bacterium with flagella. That means it is a flagellated bacterium. It has both smooth and rough phases. It occurs in, again, capsulated or non-capsulated forms and elaborates an exotoxin and endotoxin. Clinical disease is associated with the encapsulated phase 1 strains. This Bordetella pertussis is antigenically very complex and has three major antigens, 1, 2 and 3. This bacterium survives only for a short period outside the human body. So this is the mechanism of infection or mechanism of the clinical feature, the spectrum of clinical features that occurs once this Bordetella pertussis bacterium enters the human body. So the normal ciliary movement of the respiratory tract is that it's continuously moving. It's to and fro movement. Once this Bordetella pertussis bacterium enters the respiratory tract, its filamentous hemagglutinin attaches to this ciliary epithelial cells. This Bordetella pertussis, again, it releases toxins as well. These toxins also adhere to the cilia and they traverse through the cilia into the bloodstream, and they do cause infection and the other complications. But again, this toxins has a role even in the immunity, right? And that is a clinical immunity. How that is achieved because of normal immunological process or through the vaccines, but it is the toxins which play an important role in induction of that cellular immunity. So once the ciliary movements are affected or there is ciliary stasis, the cough occurs, right? What is the source of infection? As I said, Bordetella pertussis causes the disease, and once a person is infected with this Bordetella pertussis, he becomes a case, and that case is the source of infection. Most often the case is mild or unrecognizable. There is no evidence that a disease is ever, or this infection is subclinical. There is no subclinical phase of this disease. And there is not a chronic, that means there is not a chronic carrier state. By meaning subclinical means that a chronic carrier state of the infection does not occur. Now coming to the infective material, the infective material is the number of bacilli which are shed through the nasopharyngeal or the bronchial secretions. And these secretions are highly infective. Even the objects which are freshly contaminated with these secretions contain bacilli, and they become a source of infection. Coming to the infective period, the infective period is a week after the exposure to this Bordetella pertussis to 3 weeks after the onset of the paroxysmal stage, that is the initial stage. Communicability diminishes rapidly after the catarrhal stage. Now coming to the secondary attack rate on an average 90% in unimmunized household contacts. That means those people who are the contacts, mainly the household contacts, who are the contacts of the cases, this disease will occur in 90% of those cases, those household contacts who are the contacts of the cases and who are who are unimmunized. That means unimmunized household contacts up to 90% are affected once they get exposed to a case of whooping cough. Now coming to the host factors, age, it's predominantly a disease of infants and preschool children. And the higher incidence is in children less than 5 years of age. Infants less than 6 months have higher mortality. However, older children, they are an important source of infection for the susceptible infants. Coming to the sex, it's more common in females than in males. And single attack confers lifelong immunity. Like we said, that once the toxin enters, it is responsible for the clinical immunity. So once a person is attacked, he is likely to get lifelong immunity. But with Bordetella pertussis, there is no cross immunity. Now, why infants are at higher risk, why are they susceptible to infection right from the birth is because the maternal antibodies which are present do not appear to give them any protection from this whooping cough. Now, coming to the environmental factors, pertussis spreads throughout the year, but more cases occur during winter and spring months. It occurs in areas with overcrowding and poor sanitation. So, where there is overcrowding, these cases tend to rise. It's common in individuals who have poorer immunity and they are more susceptible to get the disease. Now, coming to the modes of transmission, spreads, like I said, through droplets and by direct contact. Mostly, children get their infection from their playmates, especially when they are in the early stages of the disease and the infection is mild. The incubation period is usually from 7 to 14 days, but not more than 3 weeks. So this is the droplet infection. When a child coughs or sneezes, the bacilli are sprayed in the air and other person inhales the bacilli and gets the infection. Now coming to the clinical course of whooping cough, it mainly occurs in 3 stages: the catarrhal stage, the paroxysmal stage, and the convalescent phase. Now, the catarrhal stage is the stage when there is cold, running nose, irritated cough. A person is like an initial stage. You have malaise, you have lacrimation, you have sneezing, anorexia. It lasts for about 10 days, and this is the most infectious stage. The cough which occurs in this catarrhal stage, it is the night cough, but slowly that becomes diurnal. Second stage is a paroxysmal stage, wherein there is a series of episodes of cough, usually ending with a high-pitched whoop on inspiration. And like I said initially as well, that once there is a high-pitched whoop, there is a high-pitched sound, a person coughs vigorously, it is associated with vomiting or even cyanosis and apnea. In adults, this stage, this phase of severity of the cough may be the only manifestation of the disease, nothing else. So this whoop starts 1 to 2 weeks after the cold symptoms and lasts 1 to 2 months. At the end of the coughing, spasm, thick, clear and sticky mucus may be coughed out, and cough occurs most often at the night. Coming to the stage 3, the convalescent phase. In this phase, there is a gradual disappearance of symptoms, and which usually occurs after 2 to 4 weeks. However, like I said initially as well, that the coughing may continue for weeks or months. So this is the poor state wherein the child is having a loud, crouping, crowing inspiration. The child is cyanosed, as we can make it out. Like I said, in adults, whooping is variable, ranging between 20 to 40% and is generally milder. Coming to the complications, occur in 5 to 6% of cases. Otitis media is frequent. Respiratory complications like pneumonia occur in about 5.2% of cases. And there are neurological complications like seizures, paralysis in children who are 6 months and younger. The paroxysmal coughing can lead to subconjunctival hemorrhage, epistaxis, cerebral hemorrhages as well. So, a word about the control of whooping cough. So, there are cases and there are contacts. Cases are the ones who have the disease. They have to be diagnosed early, they have to be isolated and treated. Disinfection of the discharges from the nose and throat. Early diagnosis is usually done by bacteriological tests of the nasopharyngeal swabs. So if the swab is obtained within 10 to 14 days from the onset of the disease, the chance of isolating the organism is less than 60%. Direct fluorescent tests are also used, but they are less sensitive. With new PCR technology, the ability to diagnose Bordetella pertussis has become greatly enhanced. And the erythromycin is the drug of the choice. Contacts, again, they are the ones who are possibly the contacts of the cases, and they have to be kept away from the cases. If there is a possibility that an individual infant might have got into contact with the case, again, he should be given erythromycin for 10 days. The dose of erythromycin is 30 to 50 milligram per kg body weight in 4 divided doses. Ampicillin, Septran, and tetracycline are alternative drugs. These antibiotics are useful in the contract of secondary bacterial infection. Steroids may reduce the severity of the cough paroxysms, but are generally recommended for infants with severe disease. Now coming to the active immunization, that's with the vaccine, and the vaccine which is given is DPT vaccine, now in the form of LPV in majority of the states. So LPV vaccine contains 5 vaccines including DPT, hepatitis B and H influenza. So DPT vaccine or this LPV vaccine is given at 3 doses at 6, 10 and 14 weeks. The first booster dose is given at 18 to 24 months. Acellular form of DPT, that is DTAP or whole cell pertussis component, is also administered depending upon the schedule and the immunization program. So DPT vaccine, the duration of prevention following 3 primary doses and 1 booster dose is believed to be 6 to 12 years. The role of passive immunization is not well established. Even if there is 100% immunization coverage, pertussis will not be entirely eliminated. Thank you.
You may not realize just how bad whooping cough can be. To an infant, it is a constant fight for breath that can last for an agonizing and stressful 12 weeks.
Hi, thanks for coming.
Mr. Jackson, is your wife here?
Yeah. Ruth, it's the health visitor.
To you as a parent, it is particularly harrowing having to provide constant care for your child day and night. Whooping cough is a disease that spreads easily and puts every child under 6 at risk. If you have a child under 6, talk to your doctor or health visitor about immunization against whooping cough.